Welcome to Wellness Health Services Health Talks. Today we will be talking about osteoporosis. Osteoporosis is a condition that usually affects the bones, and it is characterized by low bone mass with microarchitectural disruption and skeletal fragility, resulting in fragility fracture, and this is usually due to loss of bone strength. It is common usually in postmenopausal women, but it can also affect men. The risk factors for this include a low BMI of less than 20, history of smoking, high alcohol intake, condition like diabetes mellitus, having rheumatoid arthritis, chronic liver disease and renal disease, which are involved in bone synthesis, drug therapy, especially some of the antidepressants, use of depo-provera for more than 2 years, age more than 50 years, use of drugs for treatment of ulcers, the drugs we call proton pump inhibitors like omeprazole or esomeprazole, use of oral steroids. These increase the risk of bone fracture and also bone resorption. So how do you make a diagnosis? Usually it's by the history. If there is a family history of fracture before, use of scanning, what we call bone DEXA scans. And how do we approach this problem? One is lifestyle changes, increase in physical activity. We usually encourage more than 30 minutes of active to moderate activity. Then smoking cessation for those who are involved with smoking. Then we have increase in calcium intake from foods, usually green leafy vegetables, and also milk has high calcium content. Vitamin D supplementation for those who have deficiencies, and for also for those who have risk factors for this condition, osteoporosis. And for those where there is a diagnosis of osteoporosis after a DEXA scan, then there are drugs that we use to help increase the bone density. Drugs we call biphosphonates, usually taken on an empty stomach, taken 30 minutes before food. You should start at an upright position for more than 30 minutes, and this will help in restoring the bone structure. So in summary, osteoporosis is a condition that is common, affects usually ladies more than men after menopause, and it is usually brought about by a number of risk factors, including low BMI of less than 20, risk factors of some of the chronic diseases like diabetes, rheumatoid arthritis, and it can be resolved and prevented by increase in physical activity, increase in calcium intake, treatment of other chronic conditions to controllable levels, and also cessation of smoking and drinking for those who have this kind of lifestyles. Thank you for watching.